Good afternoon to everyone. Today's session, Cancer Patients, What Happens After COVID-19 Vaccination, is a Q&A session. And my name is Ranjit Kaur. I'm the president of Breast Cancer Welfare Association Malaysia, and I'm also a breast cancer survivor. Our eminent panel members today who will be answering questions are Associate Professor Dr. Nirmala Bhupathi, Public Health Medicine Specialist from University Malaya Medical Center, Dr. Rose Susanna Ahmad Bustaman, who is National Head of Radiotherapy and Oncology Services from Ministry of Health Malaysia, Professor Gan Jin Jin, who is a consultant hematologist from University Malaya Medical Center, Associate Professor Dr. Marniza Saad, who is consultant clinical oncologist from University Malaya Medical Center, Dr. Mandy Yap, who is a hematologist from Hospital Ampang, Kuala Lumpur, and Dr. Subhashini Ambikapathy, who is family medicine specialist from Buntong Health Clinic in Perak. So today will be a 1-hour session where we will have Q&A. We have some questions that have come in and we will be asking. I will be posing the questions to our panel members who will be answering the questions. Now, what I would like to share here is that it is a challenging time for all of us. And I would first of all like to thank the panel members for taking time off from their very, very busy schedule. As we know, the healthcare professionals and the services are totally stretched because of the COVID-19 pandemic. So thank you very much to the panel. And we need to be vigilant. We need to stay safe. Each one of us have to take on the responsibility to help the numbers to go down. While we have challenging times, we have a great optimistic opportunity here, which is the vaccine process, which has started. And some people have concerns about it. Some people have questions. So we would like to now ask the questions from the panel members. All right, so here are the panel members. So here we would like to start off the session with 1 or 2 questions first. I would like to ask Associate Professor Marniza and Dr. Gan and also Associate Professor Nirmala Bhupathi one question about what are the benefits of the COVID-19 vaccine for those who have cancer?
Thank you, Ranjit. Nirmala,
Yes,
do you want to take that first?
No, I think I'll be the last.
Okay.
I want patients to hear
Then.
from their clinicians first.
Okay, right. So benefits of COVID-19 vaccine. I think if we just say in short, the benefit would be very similar to the benefit with any other individuals when we talk about cancer patients. So it's about offering protection, okay, against the infection, COVID-19 infection. And if you look at other vaccines, because all of us are familiar with other vaccines, for example, influenza, and everyone, including cancer patients, have had a flu vaccine before. So it's very similar. The same way influenza vaccine actually protects individual from the impact of flu infection. The same thing with COVID-19 as well. It would actually give us protection. So in terms of cancer patients, similar to other individual, it try to protect us against getting severe illness, severe infection from COVID-19, including reducing the hospitalization rate and also death rate from COVID-19. And I would like to add to that in terms of for cancer patients, certainly if we can avoid getting COVID-19 and severe illness, it means that cancer patients can undergo their treatment because a lot of patients may be on various types of treatment. And if we can protect patients from getting COVID-19, meaning their treatment can continue. We know cancer patients are at quite high risk because they are usually slightly immune suppressed anyway because of cancer, and the treatment also will reduce our immune system. So that would put cancer patients at higher risk of getting COVID-19 and severe illness. So to me, it offers that protection and it's much greater because it's about trying to maintain our patients on treatment. Because if patients on cancer who are on treatment having to stop their treatment because of COVID-19, it would also impact on the cancer itself. Thank you.
So what I gather from here, Prof, is basically it keeps us alive. We won't die of COVID-19. Our chances of dying of COVID-19 is very low.
Certainly.
Yeah, thank you. Who's next? Dr. Gan?
For blood cancers, we do know that if patients who have blood cancer, if they do get COVID-19 infection, the the severity is going to be very high, and the chances of them having a lot of adverse effects are very high, and the mortality, or meaning that prolonged ICU stay and perhaps dying from the COVID-19 infection, is also very high. So COVID-19 vaccination is recommended in the sense that we want to protect the patients from having a serious or severe COVID-19 infection.
So the seriousness will be less.
Yeah, that's the hope, that with the vaccination, then the chances of developing serious or severe COVID-19 infection will be much lower.
Right. That's great. I mean, I'm hearing good news here. I'm hearing news that this can help us to keep alive. This can help us to prevent ourselves from suffering badly, and our side effects may be much, much less. Dr. Nirmala, would you like to add?
I just want to add on in terms of, so we hope that what we observe in people without diseases, in terms of protection against severe COVID, we can also see it in cancer patients. So just to get y'all, to just familiarize y'all, I'm sure some of you would have heard that in Singapore, in Tan Tock Seng Hospital, there was an outbreak, and there were many people who were infected, even within the hospital staff. And about out of the 40 cases that they detected, 8 people actually had vaccination. So that is quite a scary first thought when you hear about it. But when we look closely, what happened is among these people who were vaccinated, the 8 of them, they had very, very mild signs and symptoms, and most of them were even asymptomatic. That means we didn't know that they had COVID until they were tested. So that can be interpreted as a good news, meaning that people who are vaccinated, maybe even in the instances when they get infected, they will be free of symptoms or have very mild symptoms. So that itself is fantastic news, and that's what we want actually. So I hope, like I said, so we don't know much about cancer patients, but we have strong feelings that it will be the same. So the vaccination protects.
Okay, so
That's
protection is the main thing here, and that's what we want. And the other thing is, I'm getting to the next point where I actually would like to ask. There are many of us who have finished treatment and who are getting on with life, and we're not on any active treatment. We just go for our annual follow-up. And so I really would like to be vaccinated, but I have not received any notification. This is from one of the patients. What should I do? Yeah. Prof. Nirmala?
Okay, so if you see, right, in our national vaccination program, we have phase 1, phase 2, and phase 3. So right now we are in phase 2. So phase 2 is supposed to target people who are older, those who are more than 60, as well as those with comorbidities. That means they have some illness that makes them to be at higher risk of developing COVID. So not all diseases, selected diseases. And one of the criteria is people who might have low immune responses because of their disease itself or the treatment that they are getting. And cancer patients actually fit under this category in phase 2. So having said that, what will happen is in phase 2, we will be calling and vaccinating all patients who have cancer who are on treatment, right? So, and I just want to remind everyone that phase 2 starts from now, albeit the rollout is a bit slow, but it will start and it will go on until August, right? So there is a lot of time. So don't worry, you will be eventually listed. But as for patients who are not on active treatment, right? Some of them may actually be falling under the phase 3. So not all of them will be under phase 2. So that is something that we need to clear out. But having said that, you might have the opportunity through other means, right? Say you go to the hospital and the doctor offers you, sometimes it happens. So we have this opportunistic track. So I'm not saying it's not possible at all, but most people who are on active treatment, any treatment, they will get their vaccines by August.
So here's someone who says that he or she had the first dose of Astrazeneca and had mild symptoms of fever and tired feeling. And she's a 14-year cancer survivor, so just sharing, okay, right? All right. And So there is someone who'd like to ask if I'm having chemotherapy now. This I would like to ask the clinicians who are the oncologists as well as the hematologists. If I'm having chemo now, should I be taking the vaccine? And if yes, when would be the right time? Can one of the clinicians start?
Rose, do you want to take that, Rose?
Rose, Dr. Rose, do you want to answer that?
Okay, because actually Ministry of Health has come up with the guidelines on COVID vaccination for cancer patients. So among the MOH facilities, we have come up with a consensus. It may actually act as a guide for the other centers as well, like universities or private. But of course, it is at the discretion of the treating oncologist. So at the moment, those patients, solid tumors, ongoing chemotherapy, the consensus is to wait for the treatment to be completed at least 3 months before we can start the vaccination. This is because the concern is one, during the treatment, actually the patient may not be able to mount the adequate response and to give the proper protection. And secondly, because of the possible side effects and complications that may warrant hospitalization, and we may not be able to cope with the current burden that we are having, for cancer patients.
Thank you, Dr. Rose. Prof. Marnisa, do you want to add anything?
Yes, please. So thank you so much, Rose, for highlighting the MOH guidelines. It's actually available in public domain, so anyone who's interested, you can have access to it. And the information on mainly for cancer patients is right at the end. I think page 97 onwards. So anybody can really refer to it. And clearly, I think the main thing that I want to take on from Rose is that the guideline says then ideally we try to complete, but of course, it's at the discretion of the treating oncologist. So the best thing to do is, right, of course, we refer to the guideline, but you need, each patient need to discuss with their own oncologists who know about their diagnosis and their treatment and the risk and benefit of having the vaccination. So that's really important. Go back and discuss with your treating doctors.
Thank you. And I think that it's important for us to note that the Ministry of Health took action very fast to make sure that there are guidelines for us to follow as well, and for all healthcare professionals to follow and to know. So the knowledge that's coming from Ministry of Health, I think kudos to the Ministry of Health that is so stretched in their work and yet doing the clinical and yet doing the guidelines for us to follow. And thank you very much to Ministry of Health for that. I would like to ask Dr. Gan and Dr. Mendy as well for the blood cancers regarding the guidelines or the vaccine while the patient is on treatment.
Mandy, you want to answer that?
Actually, Prof. Gan has and Dr. Jamila have come up with the consensus statement from the Malaysia Society of Hematology regarding the COVID vaccination for patients with hematological disorders. So for those who are undergoing active chemotherapy, when they have to wait for their neutrophil to recover, as well as their platelets to be above 50,000 to be able to be vaccinated. And for those who receive the CD20 monoclonal antibody rituximab, they will be advised to take it 6 months after the last dose. Is that right, Prof. Gan? I said it.
Yeah, that's right. I think there's also a guideline that I think similar to oncology, we also have a guideline, and I think it is also incorporated into the KKM national guideline as well. So if the patients are interested, they can always download it and have a look and see where you fit in. Generally, those patients who are on active chemotherapy, if they have problem with blood count, we would then usually recommend perhaps delaying it. And there are certain monoclonal antibody like rituximab that some of the patient may have. The reason we are saying that to delay the vaccination is not because it's not recommended in a sense, but it is because you may not get enough immune response if you have the rituximab. So it's not that you can't have the vaccine. It's just that we want you to have a good response after the vaccination. And if you have an immunotherapy, you may not mount a good response. So that's why we advise delaying it because we assume that with that immunotherapy, you may not develop a very good response. But all this is from scientific basis. Obviously, there's no clear evidence at this moment, but it is through science and what we know that we think that the response may not be as good. So I think all the guideline is written there, even in the national KKM. So please do read to see where you fit in so that you know when or you can have the vaccine. And of course, like Prof. Maniza have mentioned, very important, speak to your hematologist. They will guide you and help you as well.
Thank you for that. And I think that the bottom line here that I got from here is actually the fact that you want to have the vaccine when it is most effective for you. So you are able to show a very good response to it. So that's what you want, that right moment, not before that you may not be having a very good response to it. So you want to be properly immunized and properly protected. There's a question here that says that I am waiting for my second dose of the vaccine. So can the first dose actually cover my immunity?
I can answer that, not from a perspective of cancer patients, because we don't have that much evidence yet, but from a general response, there is good reason that we have 2 doses for everyone, right? Because you want to give an initial dose, and then you want people to come up with the body to mount a response, and then you boost that and get the body to get the right levels of response to fight any infection when it comes. And it applies to many other diseases as well. So there's good reason that scientists have recommended, because it's all been through research. So for that same argument, along the same argument, so it should apply that when we say that people should have 2 doses, then please go and get your 2 doses. Unless something bad happened and you got hospitalized and you are advised by the physician that you don't take your second dose. That's the only reason I can think that anyone should not be getting their second dose. But apart from that, everybody should get their second doses as recommended, with or without cancer. I think I can get all my colleagues, all oncology colleagues, hematology colleagues nodding their heads. So I assume that all of them agree with me.
All right. And I think that our government has made that very clear that everybody will be getting the second dose anyway. So that means that all of us will be well protected after the second dose. Now, somebody says that I'm on targeted therapy and I would like the oncologist to talk about that. Can I be vaccinated while I'm on targeted therapy? Prof. Maniza and then Dr. Rose.
Thank you. Again, according to the guideline, if I'm not mistaken, correct me if I'm wrong, Rose, a targeted therapy, hormone therapy, for example, patients, based on the guidelines, they are recommended to proceed with the vaccination. But of course, again, we have to take it on case basis, because there are various targeted therapy out there and they may have different side effects profile. So we are saying, in general, but you need to then again go back and discuss with your doctor, because some targeted therapy can also affect your bone marrow, for example. And when it affects the bone marrow, causing your immune system to drop. So then again, it's a question, how much benefit somebody might get from getting the vaccination. So the key word is always discuss with your oncologist. But generally speaking, we do advise patients to go ahead. But it's just that the timing, and we might need to decide on case-by-case basis. Rose?
You are absolutely right, Prof. Maniza. I don't think I have anything else to add to that.
I've read your guidelines. Thank you.
She studied your guidelines. Okay, we have a question for Dr. Suba. Dr. Suba, we'd like to ask you, I have been registered for the vaccine using the MySejahtera app, and I'm now waiting for the eligible for vaccine to be ticked and date and place to come up on my first dose appointment. How do I prepare for the appointment? what procedures do I need to go through, Dr. Suba?
So if a patient, cancer patient, or may it be any patient who is actually waiting for the date and place, so specifically for our cancer patients, what we would like to advise for you to do would be, please try to get your carer or your relative to bring you to make a visit, if you can, to your treating doctor or your treating physician, because what we would like you to get to be done for yourself will be to have a proper pre-vaccination assessment. So what this pre-vaccination assessment would be actually to include a full assessment of your current medical condition and a review of all the treatments that you are actually on at the moment, as well as to actually have a proper, thorough, detailed treatment history that you're on, as well as medication history, and also if you have any drug allergy history. So once this pre-vaccination assessment is done and conducted, we would like this pre-vaccination assessment to be filled into a slip which we call as slip penilaian kesesuaian untuk seseorang pesakit menerima vaksin, which means to say this slip is actually readily available in the COVID-19 vaccination guidelines, which was just published middle of April last month. It's actually in page 21. So that is a slip which we would like the treating doctor to help us to get it filled and to give it to the patient. So when the patient actually comes to us in the Pusat Pemberian Vaksin, which we call it as a short form of PPV, it will make it very much easier and smoother for the patient as well as for the doctors or the paramedic who are actually performing the informed consent signature taking, because we need to actually get informed consent and written consent signed by the patient and also by the doctor. So when they come and see us in the vaccination center, it will be a very easy and smooth process. Also, another preparation that actually I would like to advise our patients would be, when you come to the center, please try to bring a fully charged handphone. Also, just a reminder, if you don't have a handphone, then bring make sure that your relative or your carer can bring along a handphone along with you, because this will also make it easier for you, because you need to actually scan your phone using the My Sejahtera code 3 times in the vaccination center to enable you to actually finish the entire vaccination process until it's complete. Yeah, so that's what I would like to just pass information. Thank you.
Dr. Suba, thank you. You have answered 3 questions.
Oops.
Anybody else would want to add something to what Dr. Suba has said? Dr. Rose or Dr. Prof. Maniza or Prof.
Can I say something first?
Yes.
Okay, this is in relation to someone who has actually put up a question in the chat, because they asked that they are no more on treatment or chemotherapy, but on hormone therapy. So can they go on to the vaccine center without seeing an oncologist? So I guess Suba can also answer that.
Yeah, thanks, Nirmala. Actually, we who are working and on duty in the vaccination center, we also actually have gone through the vaccine protocol. So it's actually quite clearly stated that patients who are on hormonal therapy or targeted therapy, immunotherapy, there should be no problem for them to actually receive the vaccination. Only those patients who are on active chemotherapy of less than 3 months, then we would actually defer vaccination for them to go back and see their treating oncologist or hematologist or their treating physician to get them to be sorted out. And once they have completed the 3 months of their active chemotherapy treatment, then only we can plan for them to actually come back for their first dose.
All right, that's a bit clearer, and people would know that they don't have to rush to the hospital to see their doctors. Prof. Nirmala, I would like you to look at the chat box to see if there are any questions. If you could help me to ask those questions.
Okay, I keep on seeing a few questions on Astrazeneca vaccine, right? So I am attempting to read 1 or 2 because I keep on seeing that. So the last one that I see is, what is your opinion on the Astrazeneca vaccine for a cancer survivor? And I think this ties in a lot with a lot of questions that I get. Can I choose my vaccine? They all know that we are in charge, being in the public health sector, that we are in charge of the vaccine center. So a lot of people ask, can I choose my vaccine? So let me answer, can I choose my vaccine first? Then I'll answer, give some information about Astrazeneca. So in terms of, can I choose my vaccine in Malaysia? At present, no, right? So there is no choice. But having said that, if you follow closely, we have the National Vaccination Programme, and then we also have our alternative vaccination option. So the National Vaccination Programme, so far for phase 1, we have been using Pfizer vaccine, right? In phase 2, as far as I know, we are also planning to use Pfizer vaccine. So at the present moment, there is no can I choose my vaccine under the phase 2 because it's only one vaccine. But having said that, we all know that there's this Astrazeneca option has been offered to the public. And so some of our patients have registered. And a lot of people are concerned about some complications associated with the Astrazeneca vaccine. So I'm not speaking from the perspective of cancer patients, right? Let's be clear, because we don't know much about cancer patients and AstraZeneca vaccine. But we do know something about AstraZeneca vaccine and the general population. So the reason people started worrying is about these abnormal blood clots that start forming in some of the vaccine recipients, especially the younger ones. So, and this is a real observation. So it's not a false thing. It is true. But I also need to highlight here that every single medication that's being given by medical professionals that has got its risks and benefits, right? So when we talk about vaccines, it remains the same. So at every individual level, what doctors will usually do is weigh the benefits versus the risk. So if a person is to benefit much more substantially from the vaccine rather than the risk from the vaccine, we say go ahead. So having said that, in the UK, because of these concerns about this rare, so let me use the word rare blood clots, which can be dangerous, in UK, they have changed their guidelines to say in healthy individuals who are below 40 years old, if there is an option, please take the other option of the vaccine. But let me tell you the caveat in UK. In UK, the community transmission at present is quite low, and they have other options present. So patients, people who are below 40 do have the option. So in Malaysia, we are slightly in a different situation. I wouldn't say slightly, much more different situation. We have variants, we have community transmission, the threat from COVID is real. Very serious illness is very real. So because of that, for people who are above 60, at least those who have registered for AstraZeneca, including those with cancer, if you have registered for AstraZeneca, you're above 60, please go and get vaccinated. Because as a public health physician, my slogan when people ask what's the best vaccine, the best vaccine is the first vaccine that goes into your arm, will be my answer. So I think I will stay with that even in the context of cancer. Unless you have been called for your Pfizer vaccine, then that's good enough. Please go and get your Pfizer shots. So I hope I have addressed the concerns.
Thank you, Prof. Nirmala. I think we keep having concerns and questions one after another, and there are so many questions that people are asking, and the doubts about the vaccine. There isn't enough evidence to say that you are 100% protected, but there is enough evidence to say that your side effects if you do get the COVID vaccine, your viral load is much lower, that you will not suffer or even die from it. You will still be alive. So that's one of the main things that we need to bear in mind. And if you do have complications, you do have severe allergies, you are going through chemotherapy and other treatments that you think may affect you, that's what you need to do. Go and see your doctor and get yourself cleared before you go for the shot. And a question here, Dr. Suba, is that I was treated for cancer in a hospital, but my appointment for vaccination is not in a hospital, it's somewhere else. What should I do? Should I still go ahead with this vaccine?
Yes, hi, thanks for the question. Actually, yes, you can go ahead, and actually the vaccination can be received. However, we would like as I mentioned earlier, we would like the pre-vaccination assessment to be done if possible. But I think I also looked at the chat box. Somebody actually asked me, had already visited their oncologist and they didn't receive the slip. So actually, no worries, not much of an issue, except that when you do come to the vaccination center, sometimes it will be a little bit of a struggle for us, which is why we would like to advocate everyone, all clinicians out there, to help us, because we are the family medicine specialists and we are the doctors, and we are actually handling a lot whole load of clients. Actually, my center, we're vaccinating up to 1,500 to 1,700 clients per day. So it will be a bit difficult if we don't have a proper assessment by the treating doctor or the treating oncologist. However, no worries, because as I can show everybody here, I'm actually having the vaccination protocol guideline with me. So we all have it with us. So looking into issues, we can actually go through and take a quick history from the patient who visits us at the center as well, just to see whether the patient is on any active chemotherapy treatment or whether they're just on any hormonals or targeted therapy or immunotherapy. So as the other distinguished speakers have also mentioned earlier, so those patients who are on hormonal or targeted therapies or immunotherapies, there should be no problem, and we can vaccinate them there and then on the day that they turn up for their vaccination date. However, as how we practice in my vaccination center, if we do run into any doubts, we have our colleagues in the tertiary hospital, in the specialist hospital where we refer our patients to, and usually also in the private hospitals where our patients are under follow-up. Sometimes we try our best to facilitate our patients to receive their vaccination on the same day that we are scheduled, because we don't want to cause them too much of a hassle to defer, go back and come back. We try our best to actually sort it out for them. If we can call our counterparts and colleagues in the respective hospital, may it be the government or the private hospital, then we try our best to help them. Unless we are very, very uncertain of the condition or the treatment that the patient is on and we don't receive the pre-vaccination assessment slip filled in, that will impose a little bit of a trouble and struggle for us there. Yeah, so basically that's what we do. So if you do turn up to the center, then we would want you to have the pre-vaccination assessment done. So therefore, let me go on to tell that who are the patients whom we actually vaccinate in the vaccination center in the community setting as to versus those whom we actually vaccinate in the hospital. So basically, patients who have any allergies to PEG, for example, polyethylene glycol substances, those who are actually on lung cancer treatments, those who are on thoracic malignancy, metastatic disease. Now, these patients actually preferably their oncologists or their treating physicians would have wanted them to vaccinate in the hospital setting. There is also a clause there on patients who are over the age of 60 years old. However, in my center, patients over the age of 60, but they are stable, they have already had their breast cancer treatment long time ago, and they're currently not on any active treatment, and we find them, they're relatively safe for them to receive the vaccine. We do vaccinate them in the vaccination center at the community setting. I hope I've answered the question.
Thank you, Dr. Suba. Just one question. What is thoracic malignancies?
Lung malignancy, sorry. Yeah.
Okay.
Any lung cancer malignancies and and those with metastatic diseases. So those again are all in the vaccination protocol that is by MOH. So usually we will refer to their treating physician. Whenever we are in any doubt, we refer to the treating physician, whether such patients we can actually proceed with the vaccination in our community center or whether they should be vaccinated in a hospital center. Yeah.
Thank you, Dr. Suba. What happens if I get the vaccine at the vaccine center and I develop sudden complications? Who will actually help me?
Okay, I'll take that. And I think Dr. Suba can also answer, because I am actually in a hospital setting. So don't worry if you come. I think those who have had their first dose will know how is it in the vaccine center in a hospital or even in a community setting. It's so well organized and there is a big team there waiting. So you will be assisted all throughout, including after vaccination. So after vaccination, what will happen is during the vaccination screening itself, they will be asking you questions like, have you had any troubles, any allergies before? So the moment you say that you have some allergies or some troubles related to vaccination, you will be given a different card. So you'll be given two kinds of cards. So the first card says that once you finish your vaccination, you have had no prior difficulties, you will be kept in the vaccination center and observed for 15 minutes, right? And if those who declare that they have had some form of allergies, some sort of asthma or itchiness or whatever, not anything related to allergies, then there will be the team keeping you for at least 30 minutes after the vaccination. So during the vaccination and as soon as after the vaccination, you don't have to worry because you will be observed wherever you are, be it in a hospital or in a community setting. I think Dr. Suba, you can also add on.
Hi, yes, thanks, Prof. So I would like to add on there, yes, exactly and correctly mentioned by Prof. Nirmala. So what we do is that right after any of our patients receive vaccination, actually, I would just like to go one step before that. When we take the informed consent from the patient, we would already ask whether our patients have any troubles or any previous allergies. So those who have severe allergies, we prefer not to vaccinate them in the community center. So when we go ahead and vaccinate patients who have mild to moderate.
I think there's been one or two questions about the side effects. So maybe we can tackle that, while waiting for Ranjit, because we can understand a lot of our patients are also on active treatment. So they're concerned about the side effects of the vaccine, whether it's going to be more, than any, other individuals without cancer. Maybe we can discuss that.
Yes, please go ahead and discuss the side effect issues.
So maybe if I can respond to a question that I see in the chat box, if a patient has history of strong allergies, the vaccination center will decide not to vaccinate. What happens in that scenario? Maybe I'll take that question. As I mentioned earlier, yes, we will actually prefer to defer vaccination because to vaccinate in the vaccination center at the community setting may not be so appropriate and not safe, because if a patient had an example, for example, previous anaphylaxis reactions and then had required oxygen or treatment and observations or even admissions in hospitals prior to coming for this vaccination, we will decide not to vaccinate. So then what happens next in that scenario? We have a very organized system. So the patient does not need to worry. You don't need to register again on MySejahtera for vaccination. What we will do is the doctor who is taking the consent, we have a separate form that we have in my vaccination center. That form was actually created by one of my colleagues. We will fill that form in a double copy, whereby we call it as the vaccination defer form. So what we do is that we will fill in there exactly and correctly on all their past previous histories, and then we will actually plan for them to be vaccinated in the hospital setting. So our tertiary hospital, which is where I practice in Perak, is a Hospital Raja Permaisuri Bainon Ipoh. So Hospital Raja Permaisuri Bainon have also assisted us in vaccinating patients who are high risk and have previous anaphylaxis reaction. So they will vaccinate them in a much safer setting. So when they get the vaccination, our team in the public health side, in the community setting, we will actually have a separate list. We will collect all the names, we will compile them, and we will also verify their names, their addresses, their contact numbers, and so on. And we will actually contact them and inform them on the next vaccination date due. Yeah, thanks. I hope that answers the question earlier.
Thanks. May I just make comment?
Yes.
Yeah. So I think of course we understand that a lot of patients are very anxious about this, but I think generally what we have to remember is that the benefit of having the vaccine is much more compared to the risk. Currently, the vaccine has been shown to be safe, based from the studies on the vaccines itself, and we know all the current vaccines that have been approved, they are safe because they are actually not live virus, so they are safe, similar to like the typical flu vaccine that people take, and a lot of cancer patients do take a flu vaccine. So in terms of specifically in cancer patients, unfortunately, of course, we do not have a lot of evidence just focusing on cancer patients, how they would actually respond to the COVID-19 vaccines in terms of this side effects, okay? But because a lot of these studies, they didn't include many cancer patients for various reasons, but there have been some cancer patients included, those who are not on active treatment, for example. So even though we cannot tell you exactly that, look, certainly the side effects are going to be exactly the same, but we know based on other vaccines before, it should be similar. But we do have some small studies looking at how cancer patients actually respond to the vaccine. And one of them is a study that was run in UK, in London, when they started rolling out the vaccine. So they included about, I think, just over 100 cancer patients that include both solid tumors, meaning all non-blood cancers, and also some blood cancers. And they also compared with some normal individuals. So based in that study, they reported actually the safety in terms of the side effects in cancer patients are actually similar to healthy individuals. But of course, these are quite a small study, but that's all we have at the moment. And it's of course, it's not done in our country, but that's all we have at the moment, which we believe is enough. Because if you look at the risk of the COVID-19 itself, we see what's happening now. We're seeing third wave, fourth wave, right? And a lot of people are being hospitalized and a lot of death. But at the same time, what have we heard about COVID-19 vaccine in terms of causing severe side effects? It's actually very, very rare. So we really have to balance between the benefit versus risk. And with some evidence to suggest that it's actually safe in cancer patients, but certainly, we need more evidence. We need to continuously look at, look at this. So we ideally, if we can actually even assess our own patients, who are gonna start having vaccines now, right? And we monitor, our own patients in terms of safety and how they benefit. That would be ideal.
Thank you, Prof. Marniza. And was there someone else who was going to speak just now?
Can I add on
Yes,
to what Prof mentioned? Actually, I am also very happy to mention that this is only from my personal experience in my vaccination center. So far up to date, we have vaccinated so many cancer patients and also so many cancer survivors. And really, there has not been much issue at all. I've had friends and family members also who have been vaccinated, and they're all good. So actually, we want that to take place. So there should be no fear at all. Yeah.
Okay, I would like to add here, because we have almost 200 people who are logged into this session today. I would like to bring it to everybody's attention that our medical people, all over the world, healthcare professionals, they're not salesmen. They're not going to say that this item is good, but they always weigh benefit and risk. And they look at, if the benefit is much higher than the risk, that is what they are saying that it can be done. And all medications also follow the same kind of protocol. It's to do with benefit and risk. If we have a good benefit out of it, we take it. Now, I mean, sometimes you go out and you buy all kinds of things out there that are being, salespeople and multi-level marketing and stuff like that. And somebody out there who is not qualified tells you this is good, take it, and you take it. But when it comes to the vaccine, there seems to be just a whole lot of concern and fear and issues like that. And sometimes there are these sporadic information, sometimes stuff that is being channeled out in the social media, that people get affected by the negative part rather than the positive part. So I think we need to focus on that. And I don't think that any of our government people or even our healthcare providers are going to put us at a risk. So we need to bear that in mind. And there are a few other questions that I wanted to ask before we end. What happens if I don't get any app reply for the vaccine through My Sejahtera after I've been registered? What can I do about it? If any of you would like to answer. Dr. Rose, do you want to respond to this, or if anyone else wants to respond?
Okay. For cancer patients undergoing follow-up with the MOH facilities, they can actually refer to their centers back and inform them, regarding the need for vaccination and the appropriate things like Dr. Subah has mentioned just now would then be arranged.
Yeah. So there it is, very clear. You always have the opportunity to refer back. The other question here is, will there be another opportunity to register for Astrazeneca? It is getting very popular here.
I can take that, Ranjit.
Okay.
So we had the first session. It was announced a couple of weeks ago on a Sunday, and there are going to be other calls as well, but maybe this time not in Selangor and Kuala Lumpur. It might be in other states. So we just have to stay tuned because this is under Ministry of Science. So the minister will be announcing for those who think that they want to take up the offer from Astrazeneca. Then it will be announced at a future date.
So keep tuned. It may be announced very soon. And I have a question now for Prof. Maniza, Prof. Gan, and also Associate Professor Nirmala. And this question is, how do we know for whom the vaccine will work and for whom it will not work? Are there any exclusion, very strong exclusions?
Maybe I would allow.
Or do we know?
Okay.
Yes, Prof. Maniza.
Maybe I would allow Prof. Gan to have a word first.
Yes, Prof. Gan.
Okay. I think a lot of studies of the vaccine response in hematology patient, basically a lot, there's not much of study, not many studies are being performed. But from science, we know that we need our B cells, we need our T cells, which is a type of white cells, to help us to create or mount an antibody response. So there are certain groups of patients that I've mentioned earlier, like those who are on certain anti-B cell or B cell depleting agents, like rituximab, or those who have undergone transplantation. So basically, the immune response is not going to be very good. So it is similarly, we are learning from what the previous vaccine experience that this group of patients have. They usually do not have enough cells or to teach the body to mount a good antibody response. So Mandy, do you have anything to add? Mandy?
Dr. Mandy?
Oh yeah, I think what Prof. Gan is saying is quite true, as well as those with primary immunodeficiency disease as well. They also have very poor response to the vaccine.
Thank you.
Yeah, so but I think that's one thing to mention, even though we think that they have poor response, but different patients may respond differently. We are assuming that everyone is the same based on science and things like that. But like I say again, but different people may have different recovery of their immune response. So it is just as a general guideline for those patients who have transplantation. Basically, we think after 6 months, their immune cells are then able to recover. But there may be a group of patients may be able to recover earlier. There may be also a group of patients may recover later. So, but general rule, this is what we think in that sense. Yeah.
Okay, thank you. And so it's all to do with the immune system and the immune response as well, from what I hear.
Yep. So for solid tumors, when we talk about solid tumors, we are referring to non-blood cancers, like, for example, breast cancer, prostate cancer, lung cancer, colon cancer. Okay, so for those group of cancers, I think in a way we're a little bit luckier compared to blood cancers, because generally speaking, patients with solid cancers may have less of an immunosuppressive effect. And then also our treatment may be not too aggressive, such that, we still have quite a better immune system, such that patients with solid cancers, including on treatment, have a better immune system compared to the blood cancers, and the chances of us producing adequate response, to the vaccine to get that protection is actually higher. But of course, if you compare with a normal person, it might be a little bit less. But again, if you look at a lot of the vaccine studies, like in flu, etc., which we have more data on, right, it has been shown that patients with cancer still produce a good response to the vaccine, and it is still of benefit. So they still get protection It's just the variation will be in terms of the degree of protection. Might vary from one to another, but overall, most people get protection. And again, I would like to touch, sorry, I know time is short, but I'd like to touch again on the study that I mentioned, from London. They did just a couple of months ago, which they looked at the cancer patients. And it's really interesting because they looked at the immune response or the response to the vaccine, after first and second dose, and compared between patients with solid cancers, blood cancers, and also normal patients. And what they showed was that overall, a lot of people actually produce response, okay? But as expected, it's a little bit less in terms of the rate of response, a little bit less in cancer patients compared to the normal people. But after the second dose of vaccine, right? So in patients with solid cancers, it went up to almost 100%, meaning even though it's actually a little bit less after first dose, but after the second dose, almost 100%, about 95% actually produce response. So that's suggesting that, we're still able to produce that response in cancer patients, and they're going to get the protection. So I think that's really, really encouraging. But again, that's all the data that we have, okay? And it will be great if we can also, run a similar study, and look at the benefit versus the safety in our group of patients. And maybe at this point, I'd like to get Prof. Nirmala to comment.
Yeah, before Prof. Nirmala speaks, I would like to say what all of you have just said and explained to us. It sounds so optimistic for me. I can't wait to get my vaccine. Prof. Nirmala, over to you.
I think many of the clinicians here have already said, but I think one thing I want to say before even about the study is that in cancer patients, the concerns that we all have been talking and preparing guidelines for is not so much about the safety. I think that's what everybody have to be clear. Cancer patients, we are not talking about safety. We are more concerned about making our patients get the best benefit out of the vaccine. So it's more about like maximizing benefit. So that's what you all have to go back with today, right? So safety, actually, to be honest, we think it's just as safe as it is in people without cancer, right? So that is what I hope that you all carry that message back home. And going back to the need for more evidence, all the things that we have been talking now is evidence from clinical trials, like things where they have been experimenting on the drugs, and people who have been involved in the experiments, we have been observing them, and we are still observing them. Because even when we find that the drug is useful, even after we start administering the drugs, the manufacturers sell the vaccines around the world, what keeps on going at the background is there is this constant recording of all these side effects. So that happens as we speak. And beyond the clinical trials, we also have real world evidence, what happens in real life. So there are some studies that Dr. Marniza, Dr. Gunn, Dr. Mandy, Rose, and Dr. Subha have been talking about, about how we have seen that results are encouraging. But having said that, we also don't know much about how things will be in different ethnic settings. So again, mind you, I'm not really talking about safety per se. Yes, we are interested in safety, but we want to talk about how good or how successful the vaccines are. So for that, we are planning to start a study where we are going to enroll patients, cancer patients who are receiving vaccination. We would like to go do serial monitoring and see whether their antibody responses, how is it picking up? Is there difference between one ethnic group versus the other? Is there any difference between different age groups? So between sexes, between male and females. So those are things that we are really looking forward to, because that will give us a lot of answers. Some of you have asked answers. Some of it, we don't even have those answers at present. So this study that we plans to, disentangle and address that. So that will be our concluding statement from my end. So that's all, Ranjit.
Thank you, Prof. Nirmala. Is there anything else that anybody wants to add?
I think we can go around the table, Ranjit.
Yeah, I wanted to do that. So can I start with Prof. Rose?
Okay.
Dr.
Regarding
Sorry, Dr. Rose, I made you Prof. You're actually much higher than that.
Regarding the guideline, actually, of course, with medicine is very dynamic. It's ever changing, and most likely there will be new updates and new findings, and there will be some changes that will be made to the guidelines. So I'm just going to share about that.
Yes, thank you. And thank you for the hard work that you are doing and your colleagues are doing in Ministry of Health. On behalf of cancer survivors, thank you to Ministry of Health. And we'd like to now, I would like to go to now Prof. Maniza.
Thanks, Ranjit, and thanks everyone in the audience for attending. So I think I really want to share the excitement that we have, because currently I want to let you know that a lot of hospitals that offer cancer services, the vaccination is being rolled out in these hospitals. So when you go to your appointment, please do ask. If you don't, anyway, your doctors will actually start talking about it. This week we have started, we have got many patients enrolled already to get the vaccination, and dates already arranged. So we're actually very, very excited to be offering this opportunity to our patients, and I hope you're going to be as excited as we are too. So then my next message is, make sure you get the vaccination, and make sure you get the full dose, first and second dose. But at the same time, make sure you continue with the what we call it, the related measures, the COVID related measures to prevent infection, meaning the physical distancing, shielding, wearing a mask, and hand hygiene. Even though you get your vaccination, doesn't mean you can forget about all that. So please, please remember, always keep yourself safe. So thank you so much.
Thanks, Prof. Next, can I go to Prof. Gan?
Yeah. Okay. Thank you very much for inviting me to speak to everybody. I think it is very important that we remember that we have, even though we have been vaccinated, that we should still keep our physical distancing, wearing masks to protect ourselves. Because we can say that we are immune, but we do not really know how much of immunity we do have. So to protect ourselves and also to protect others as well. And for the vaccination, it's very important and crucial that you speak to your treating physician if you have any doubt. Yeah, thank you.
Thank you. And we go to Dr. Mendy.
I think thank you for the organizer to invite me. First of all, I actually learned a lot from joining this panelist. And I think what everyone is saying is true. I think the vaccination, the benefit outweigh the risk. I think for all the cancer patients, we should encourage them to go for it. And like Prof. Maniza has rightly pointed out, our center, Hospital Ampang, is also rolling out the vaccinations to the hematology patients. So all the patients come to follow up can actually ask directly to the hematologist about the suitability of them to be vaccinated. So don't worry about it. If any questions, just bring it up to your primary treating physician. Thank you.
Thank you, Dr. Mendy. Subhashini, would you like to say something, Dr. Subhashini?
Yes, please. Thank you so much to the organizing committee for inviting me. And my last words for this session would be to tell all of our dear cancer patients and cancer survivors, please get yourself registered. Do visit your doctors who are treating you, get your pre-vaccination assessment done, and please do come and visit us at the vaccination center and get your vaccine successfully. Thank you.
Thank you very much. And last but not least, to Prof. Nirmala.
I think I've said what I wanted to say, and all my colleagues have, done all the things that I forgot to do as a public health physician. I think mainly that when you think you're immunized doesn't mean that you are immune from getting infected. We still see some infection. So please take the precautions. You will stay protected, but at the same time, you also need to protect others around you. So sometimes these people who are vaccinated may think that they are protecting others, but they might be having infection and passing on to others. So that's also a concern that we don't know much at present. With that, I think thanks a lot. I learned a lot too. So, and I see that a lot of patients and survivors have said thanks. So we hope to be back with more information in future as we go, because we are still learning as well, right? So thanks, Ranjit. This was very well organized. I must say thank you, because the moment I contacted you, you were so fast to organize and your team has been fantastic. So I think everybody should say thanks to BCWA for this nice thing. And of course, all our wonderful panel of experts. Let me tell everyone how busy our clinicians are. So because I'm a public health physician, I don't have face-to-face interaction with individual patients, but all the rest of them have very busy clinics. And the fact that when I called like 2 days ago and asked, hey, Rose, hey, Mandy, hey, Gun, hey, Marisa, please, can you come? They never asked a single thing and said yes. So I think we all should applaud, for their commitment and for readiness to be here to address any questions. So please let us thank all our very, very super busy clinicians who are being wonderful heroes. So that's my parting statement, actually.
Yes, before I end, I will bring everybody to a huge gallery to clap hands and also to thank the eminent team of our expert panels. I would like to say, reiterate here, wear your mask, whether you have the vaccine or not. You've got to keep continuing to wear your mask.
That's
And
right.
the other thing is, remember, benefit far outweighs the risk. Benefit far outweighs the risk as far as the vaccine is concerned. And also today, almost 200 people joined this session. And thank you for listening. We have a very good team of approachable healthcare professionals in our country today. You ask them and they'll answer you and they will support you and they will educate you. And that's what they have done today. So to the healthcare professionals who are here as the expert panel, we are here and alive because you are there for us. So thank you for being there for us, because I would not be alive today if not for my healthcare professionals in Malaysia who took care of me, and after treatment, I'm alive. And today we've got the vaccine. Let's get it. Let's get the benefit of it and continue to live life. And let's get our healthcare professionals also to do some study to find out how we are doing in the future with regards to this vaccine. So can we have everybody in the large gallery to come forward, put on your video, don't have to put on your audio, and we take a good group photograph, and let's give a big clap to all of our eminent group of panel experts. Thank you very much. With this, I end the session.
Thank you. Thank you.
Thank you.